Good afternoon, and welcome to the NeuroNetwork for Emerging Therapies Symposium on Brain Health and Exercise. I'm Eva Feldman, Director of the NeuroNetwork for Emerging Therapies. Today, I'm joined by two colleagues, Dr. Jacob Haus. He is the Associate Professor of Movement Science and also the Director of the Bioenergetics Human Core here at University of Michigan, and Mr. Brett Knight, who's Program Manager of Physical Activity for MHealthy, which is our program for health and well-being here at Michigan. We hope you will enjoy our symposium today. At the end, we will be taking questions. Please use the question chat function, and we will also be answering questions that were sent in to us. Let me begin by discussing the science behind the impact of exercise on brain health. I want to make 3 points today. First, to review the role of exercise on systemic and brain metabolism, then to examine the impact of exercise on brain chemistry, and finally to discuss the effects of exercise on the birth of new stem cells, something known as neurogenesis in the brain. Now, sedentary activity or the lack of activity results in poor systemic metabolism, raises blood pressure, raises cardiovascular risk and stroke risk, promotes obesity, and really impairs muscle efficiency. While exercise alleviates all of those negative effects and really promotes a healthy body. And we do that a healthy brain requires a healthy body. Here's a very interesting study on one aspect of healthy brain metabolism. Glucose is the major substrate for brain energy. And in healthy brains, if you look at glucose uptake indicated as high in red, you see there's high glucose uptake. However, in individuals with Alzheimer's disease, they have very poor uptake of glucose for energy in the brain. A study was done of 93 adults who had no evidence of dementia, but could have developed Alzheimer's disease. In these individuals, they were told to either exercise at a low intensity, rarely, often, or very often, or at a moderate intensity or a vigorous intensity at those three same levels. And what you can see is when they exercised often at a low intensity, there was a clear increase in blood glucose uptake. So the brain, had more glucose for brain energy. And this was even seen at a greater dose-dependent effect with moderate and vigorous exercise. So exercise improves the ability of the brain to use glucose as a source of energy, so improved metabolism. The second point is that exercise boosts your brain chemistry. So neurotransmitters are chemical messengers that the brain uses to transmit signals between nerve cells. Neurotransmitters enhance brain cognition, mood, and allow you to have good sleep. And many brain diseases actually have neurotransmitter deficiencies, such as Alzheimer's disease has a deficiency in acetylcholine, and dopamine has a deficiency in Parkinson's disease. Now, there's one critical neurotransmitter in the brain for good mood and a sense of happiness and health, and that is the neurotransmitter serotonin. In this particular study of young adults, what was shown is the dose-dependent effect of exercise in plasma serotonin levels. And depending on if you engage in low, moderate, or high intensity exercise, you can see that there's a clear increase in plasma serotonin. And this is critical for good mood. You may have heard of drugs such as Prozac or Zoloft, which are drugs that increase brain serotonin levels to make you feel well. But exercise is just as effective as these drugs. A second study looked at endorphins. Now, there is a whole literature on how exercise increases brain endorphins. And here is one study looking at beta-lipotropin, which is the precursor of endorphin, and endorphin in individuals who exercise and measuring these same compounds, which are very low in individuals who do not exercise. So exercise clearly boosts brain chemistry. Finally, exercise increases the birth of stem cells in the brain, known as neurogenesis. Now, we all have neural stem cells, these dormant adult stem cells in our brain. And what occurs is these stem cells can actually be born and make new mature neurons that improve our ability to think. The hippocampus is a critical area for memory formation and for cognition. Here's an MRI of an individual. Here's then a sagittal section of the brain. So this is the eye, this is the nose, and this is where the hippocampus is. Now, number one, exercise increases actually blood flow to the hippocampus. And this is measuring blood flow in man before and after exercise. And you can see a twofold increase in blood flow in people who exercise. Secondly, and maybe even more astounding, is this study, and this has been replicated multiple times, looking at individuals who engaged in low intensity to moderate intensity exercise on a very regular basis. And the volume, the actual size of the hippocampus was measured over time. And what you can see is there's an increase in hippocampal volume in these 60 individuals who exercise compared to these 60 older individuals who did not exercise. So you can actually have an increase in brain volume secondary to the birth of new stem cells in your brain. This is likely best shown in an animal model because it's hard to actually look at the birth easily in man. And in this particular series of very excellent experiments, a mouse exercised on the wheel, and the birth of stem cells in the mouse's brain, in mice brain, were looked at. And here you can see the birth. These are brand new stem cells that have just been born. And they've become, of course, these beautiful nerve cells or neurons with the projections that allow these animals to become cognitively much improved. So in both mice and man, if you exercise, you have birth of new stem cells that improve your cognition. Now, to talk about different types of exercise and its effect on brain health, I'd like to pass the baton to my good friend and colleague, Dr. Jake Haus.
Well, thank you, Dr. Feldman, for that kind introduction, and thank you for the invitation to be here with everyone today. So the title of my talk will be Fighting Cognitive Decline with Exercise. And so my objectives for today are threefold. Number one, I'd like to discuss with you how exercise is medicine for the treatment of cognitive decline. Number two, learn how the therapeutic benefits of exercise are mediated by a group of bioactive molecules called exerkines. And number three, I'd like to review some of the evidence of how high intensity exercise promotes the generation of these exerkines and promotes positive brain health. So as an exercise professional and a researcher, we really believe that exercise is medicine. And so the therapeutic benefits of exercise extend to not only the cardiometabolic health, cardiovascular disease, but also into the spectrum of the brain. And so when we look at this particular schematic here, we see a growing aging population. We see folks that may be afflicted with mild cognitive impairment, which is defined as a syndrome where cognitive decline is somewhat greater than expected for your age, but does not impair your activities of daily living. And then one can progress further into a more serious forms of dementia or Alzheimer's disease. And then there are other dementias or other conditions where cognitive decline can be associated with that particular condition. And these are things like multiple sclerosis as well as Parkinson's disease, which are both known as neurodegenerative diseases and can have cognitive decline associated with that. And so exercise spans the spectrum of being therapeutically beneficial for all of these conditions. So how is it that exercise mediates this therapeutic benefit? Well, I introduced to you this concept of exerkines. And so what exerkines are the bioactive compounds that are released into the circulation in response to exercise that mediate that beneficial effects. And so we can kind of summarize it as it's the good stuff induced by exercise that floats around in the blood. And so when we look at this cartoon here, we see this exercising individual. And now we can see how all the different organ systems are affected, such as the fat tissue, our skeletal muscles, the liver, all three of which can promote the generation of factors that we're calling exerkines into the blood. And then once they reach into our bloodstream, then they'll be delivered by the brain into our nervous tissue, such as the spinal cord and peripheral nerves through the circulatory system. And what we've learned from our evidence in this arena is that these factors include a number of bioactive molecules that then induce positive benefits on the brain and the nervous system, such as adult neurogenesis, which you learned about just a few minutes ago by Dr. Feldman, benefits to cognition, which are most important to some of our work, improvements in mood, as well as synaptic plasticity, which refers to the ability of nerves to communicate with one another. And so we really believe that some of the biological underpinnings of how exercise mediates the effect on the nervous system is through these bioactive compounds called exerkines. And so we think that exercise intensity is extremely important for how exerkines are released, as well as promoting brain health. And you got a snapshot of this just a few minutes ago as well with Dr. Feldman showing that higher intensity exercise seems to be more beneficial. And so exercise intensity refers to how hard your body is working during physical activity. And when we look at the designations of exercise intensity, which I'll refer to as low, moderate, and high for the purposes of this lecture, we designate low, moderate, and high as the percentage of that maximal heart rate that one can attain. There's some easy ways that you can estimate your maximal heart rate that I believe Brett Knight, our next speaker, will be talking to you about. But low intensity refers to kind of the lower range of our maximal heart rate, the moderate range, and then of course the high range. And the evidence would suggest that vigorous or high intensity exercise results in greater improvements in our heart and cardiovascular disease and leads to a less premature death. So I'd like to share with you some evidence from the literature of these exercise intensity specific effects on important exerkines to our body. The first one I'd like to talk to you about is called brain-derived neurotrophic factor. It's known to induce adult neurogenesis, and it's released from the skeletal muscles and also the platelets and neurons with exercise. And you can see that as we increase from moderate to high intensity, and then as we increase from either 20 minutes or 40 minutes of activity, we can see that the number of people that increase their circulating BDNF is actually the highest in those that exercise at high intensity for the longest period of time. And we see a similar trend here with another exerkine that has been classically studied for a number of years called IL-6 or interleukin 6. The effects of this exerkine are known to promote good metabolism, promote glucose uptake into the skeletal muscles when IL-6 is elevated in response to exercise. We think it mainly comes from the skeletal muscle, and we can look here and see that moderate has greater effects of promoting IL-6 into the circulation compared to low intensity, and then of course high being having the greatest amount of IL-6. The last one I'll share with you is called adiponectin. Adiponectin actually comes from our fat tissue, and the fat tissue and our muscles talk to each other pretty eloquently. And when the muscle is exercising, it sends signals to the fat, and then the fat releases this compound called adiponectin. And then it goes on and travels, of course, to other areas of the body which promote healthy metabolism. And we see that the individuals that exercise at the highest intensity have the greatest amount of adiponectin release. With our next few minutes, I just want to share with you some of the ongoing work we have going on here at the School of Kinesiology and the University of Michigan. The first study involves how do we maximize aerobic exercise for benefits with cognitive health? And so what this study is designed to do is to combine aerobic exercise, high intensity aerobic exercise, with an MRI-guided brain stimulation of the brain centers called the hippocampus. When we find the hippocampus through an MRI scan, we can then target it using a special device called transcranial magnetic resonance stimulation. And what that system does is it sends magnetic energy to brain regions, which then promote these brain regions to connect and talk to one another. So we think that by combining aerobic exercise with this transcranial magnetic stimulation, we can maximize the effects of that exercise and promote the greatest benefits for memory performance. As you can see here in this particular graph, which was done now back in 2014, the group that encountered stimulation from the transcranial magnetic stimulation device actually had greater benefits in memory performance than those that did not undergo the stimulation. I'd like to also share with you a quick study about Parkinson's disease. Now, Parkinson's disease also manifests in some of these early cognitive declines and memory issues. This current study that we have going on here at the University of Michigan is a phase 3 clinical trial that's being run here through my lab at the University of Michigan. And it's actually the first study to investigate the effects of moderate versus high intensity aerobic exercise on Parkinson's disease patients and the progression. And so with that, I'm going to close, and I would like to thank you all for your attention. I'm going to now turn over the symposia to Mr. Brett Knight. He's the program manager of physical activity at MHealthy here at the University of Michigan.
All right. Thank you, Dr. Haus, for that introduction. And I am super happy to be here, super humbled to be here. I am Brett Knight. I am the program manager of physical activity at MHealthy, and also a certified personal trainer, exercise physiologist. And we'll take you through how exercise works for you. Lots of good science here, lots of good things going on. What it all boils down to is, how do you keep exercise going for something that is important to you? How do you make it personalized? And that's really where I come in as the personal trainer, is helping people find things that are very important to them, and then also helping them maintain that stuff. So we're going to define sedentary behavior real quick. We're going to look at why it's essential, which we kind of already looked at some of the really good benefits of why it's essential, but we're going to really talk about your body and the systems and why it should move. We're going to design a quick physical activity plan. I'm going to run you through something real quick that I would take first-time clients through, and then show you how to maintain it. That simple, right? You're always going to be moving. Everything's going to be great. I always try to put my dog in every presentation I do. His name's Jake. He's awesome. I love him. This is Jake being sedentary, because sedentary is going to happen. You like to sit down. We like to take a load off. We like to watch TV. We like to read books. He will probably hang out with you and have a good time, but we can't always be sedentary. But sedentary action is anything that, you know, is below that light activity, not sleeping so much, but below that light activity in the sense that it puts us in that non-moving state. Really not great for the body. We really need to get up and start moving around, doing things. And as you notice here, we have a really good graph, puts us in on the red side, going over to green. And this is from the physical activity guidelines for Americans, second edition. And it just lowers that all-cause mortality the more we move, no matter whether it's light, moderate, or vigorous. So really just starting to boost up that activity, that's the first route we go. What counts as activity? Pretty much anything. Anything counts. It's now just, okay, and where am I seeing benefits versus the risks? Because anytime you move your body more, there's going to be risks involved with it, right? I'm going to increase my heart rate. I'm going to put myself in situations where I need to move my body in different ways, and my joints might be at risk or whatever. But we just don't want those risks to outweigh the benefit. So we want that physical activity to add up to really good benefits from exercise. How much is recommended? About 150 minutes a week. We really are seeing now, we as the community of ACSM, which is American College of Sports Medicine, CDC, lots of different places are coming together to say 150 minimum is that kind of ceiling where we want to string together aerobic activity. We want to string together movements that is beneficial for the body and get it to 150 minutes or more a week, and do it across as many days as you can. Don't just try to jam it all into Saturday or something like that. If you get more on one day, great, but try to balance your day with that. And then how long to see the results? So many awesome results from Dr. Feldman and Dr. Haus. So many cool things coming from benefits for the mind, cardiovascular, whatever it may be. That stuff is, some of that stuff is a little more habitual. It's a little more long-term, whereas the acute stuff is very, very important. We get them both. We get short-term and long-term. And the short-term, I, as a personal trainer, really tell my clients to focus on very, very early. Do I get that mood boost? Do I feel better in my morning meetings if I work out in the morning? Do I get those immediate reactions from the catecholamines and all the endorphins that are going through my body when I do some physical activity? And then, oh, all that cool stuff adds up to the long-term benefit of course, I want to, stave off Alzheimer's disease. I want to stave off those things. I want to make sure that I'm getting all those long-term benefits, but those come with more habitual movement, getting those patterns down. And how do we do that? Well, any of the movement. You see pictures here, gardening, cleaning your house, going to an exercise class, getting out to nature, they're all important, all of them. But when we want to link them together, what we really want to start doing is looking at, okay, do my movement patterns then get supported by maybe some of my structured physical activity? So my frequency, the intensity of my exercise, the time of my exercise, and the type. I like to bring up the FIT principle. It's kind of old, but it works really well with my clients, I find. And we talk about, okay, we're going to start developing a physical activity plan around how many days a week do you do this? We do aerobic activity for 5 days. I get out and walk, or I ride my bike, or whatever that may be. I maybe do some strength training, and I lift some weights, or I do some home gardening, or maybe I have a physically active job that requires me to do stuff. We need to challenge the muscles. If you're not challenging the muscles, we're not getting some of those really good benefits that we need. And then flexibility, moving, getting range of motion. Intensity, we talked about with Dr. Haus a little bit. We're going to come back to it real quick and how to measure it. So I'm going to skip over that real quick. But the minutes is super important. We're knowing that if you're not getting up to that threshold, that 150, that 75 of vigorous, whatever it may be, we're not really seeing the good feedback from the benefits of people. And we really want to make sure that we're getting those minutes. You might not start out at 150, but you want to start working your way to 150 or more whenever possible. And then just finding the type that suits you. That's whether that's working with a personal trainer, going to an exercise class, whatever that may be. These are super important. Measuring your intensity. We talked about moderate, vigorous, high intensity, things like that. Talk test. One of the best ways, in my opinion, to look at moderate versus vigorous if I can't measure heart rates. Can I have a steady conversation? That's probably going to be a good moderate idea if I'm walking along or biking along. Or do I have to take breaths in between words? And man, I'm getting a little sweaty. It's a little harder to do. I can't keep up as much. That might be pushing into vigorous. Heart rate. So I wear an Apple Watch, whatever device you have, we can measure heart rate. And we, as Dr. Haus talked about, we can talk about 220 minus your age, and then taking a percent of that being a very good way to look at where does my heart rate fall in these gaps. If it's 60 to 75%, that's maybe putting me in the moderate category. If it's the 76 to 90, that's where the vigorous and really getting that harder work in. And then I can start to pair it with what's called perceived exertion. I can start to fit talk test into, hey, okay, this feels about a 3 or a 4 on this 1 to 10 scale. And I'm noticing that when I'm walking, my conversation goes pretty well. And now that's my moderate work. My heart rate, I'm starting to fit my zones of maybe it's 130 to 150, and that's fitting into a 6. Okay, cool. I'm starting to link more scientific measures with that RPE scale. Really, really good stuff. And then coming away from that intensity, once I've found a good balance of that moderate and vigorous, how do I maintain it? Well, I make goals. I make specific, measurable, attainable things that are important to me. Not just, hey, I want to make sure that I am the most fittest person. Maybe it's just, I like to make sure I can walk with my dog or my kids or whatever it may be. Make those goals attainable at first, and then start to find what pushes you more from there. I think that's where we really lose that balance and we start to see the risk outweigh the benefit a little bit, is we might push too high into vigorous too fast, and then injuries come in or things like that. We want to make sure that we have those smart goals established. And that really is all there is to it. Now there's a lot in between, but it really is finding the plan that works for you, finding where those intensities lay out. Thank you for listening to the presentation. We're going to take it back to Dr. Feldman, and we'll do some live question and answers.
Excellent. Thank you, everyone. Sorry that we had a few Zoom technical difficulties, but I think we're on track now, I hope. We've got a set of excellent questions, more than we could certainly answer in our short allotted time. We'll probably go 5 minutes over. We understand some people will need to leave at 2:30, but if you stick with us till 2:35, we'll probably be able to answer several of the questions. So Brett, I'll start with you. I think this is a great one, not probably my problem, but how many minutes of exercise per week do you notice diminishing returns on the benefits? So is there too much exercise? Is there a plateau one can reach?
Great question, right? Because people are like, I want to get the best investment that I can get. And when I'm talking with a client and we're talking about how much exercise they want to get per week, the diminishing returns really come in where it's like, well, what are you trying to achieve from it, right? If someone is really only trying to hit that, hey, I just want to have basic, and I want to have basic benefits of what's going on, they may never get into that athletic or style exercise. And they'll never have diminishing returns. They're going to hit that 150 to 300 to maybe 400 minutes of just good exercise a week, moderate to vigorous. And they're going to reap all these awesome benefits, and they probably won't noticing any diminishing returns. What I think starts to happen with the diminishing returns is when people are setting goals maybe above that just moderate intensity exercise, or sometimes venturing into vigorous, and they start to maybe either overtrain or they're going way too much. We can see that sometimes where the risk really doesn't get any lower for like all-cause mortality or anything around 7 to 8 hours a week. Like if I'm getting someone who's doing like 15 or something like that, I'm like, how's your body feeling? I start to ask, how are joints feeling? Is the risk really getting too high for the benefits that you're getting for that? So I would say if you're getting 7 to 8 hours, you're doing an awesome job, and I would really start to look at.
Okay, good. Well, that's good to know. Not my issue, I wish, but it should be. Okay, and so here's a question for you, Jake. We hear so many things about the minimum exercise requirements for health, our general health, but specifically as it relates to brain health. I think this is a great question. What would you recommend as a minimum weekly for brain health? And also, do you believe weight training counts towards this minimum weekly?
Yeah, thank you. Great question indeed. The short answer is the verdict is still out on the ideal exercise dose for brain health. But I agree. I would think that Brett and I would agree that you should be trying to meet the minimum requirements, which are 150 minutes per week of moderate intensity exercise. Now, not all exercise is created equal, and one exercise may be better for one person than it is for another. I will say that most of the research with human and animals would suggest that when you increase aerobic capacity or increase your heart and lungs and blood vessels' ability to work, that you see benefits with cognition as well. However, other forms of exercise, like say something like low intensity yoga or Tai Chi that links more mindfulness with the movements, and things like resistance training, both of those have seen benefits to cognition as well. But because they don't work the heart and the blood vessels in the same way, we really don't know how they promote the cognitive changes just yet. And so we really need more research in that area.
Okay, thanks. Okay, I think I'll take one. There's many. I'd love kind of to take them all. But this is a very interesting one. Any information about body weight set point and fasting? So, your body weight set point supposedly is genetically inherited in part, and that's environmentally also, there are a lot of environmental triggers to it, but there's supposed to be an ideal body weight that each person has. And you'll go over your ideal body weight if you develop insulin resistance, which occurs from overeating. And that is secondary to the fact that you make these hormones. They're not exerkines, unfortunately, a hormone known as leptin. And if you make too much leptin as you overeat and develop insulin resistance, you no longer have the satiety ability in your brain. So you're always hungry. So what about then fasting? Well, intermittent fasting actually decreases leptin levels, increases insulin sensitivity, and can help you achieve and maintain your normal body set weight or set point. So it is interesting. So there is clearly a role for fasting and intermittent fasting in maintaining a normal body weight. So Brett, I'll go to you next. And is someone has had a procedure and they were really pretty good exerciser before, moderate to intense exercise. And since the procedure, they just have lost the motivation to restart exercise, and it's been more difficult. Do you have any suggestions?
Totally. And that's going to happen.
That's kind of your sweet spot. That's what you do, isn't it?
I could talk for an hour on this.
Okay, you have less than a minute. You have less than a minute.
Okay, here we go. The big thing I would say is it's going to happen to everybody, no matter whether it's a procedure or something. There's always going to be a breakdown in things, right? Because everything that starts ends at some point. So the thing is how do you then bring up, if there is an end to your normal activity pattern, how do you get back into what you liked about activity before, and knowing that it could have changed based on, hey, maybe my joint is different now, so I'm going to have to find a different mode of exercise, or I'm going to have to find something else that I enjoyed about that boost that I got from that heart rate raise or whatever it may be. Worked a long time in cardiac rehab, and one of the things that we told people the most was, you had a major event happen. This is normal that it feels hard to get back into the movement, but we're going to work slow. We're going to take it slow and steady at first and ramp back up to those things that you enjoy doing.
Okay, that makes sense. And then I guess, Jake, last question, and then please feel free to email me other questions. And for those questions we haven't answered, I will be emailing those individuals who asked. So concerning, you spoke very nicely, Jake, about the different levels of exercise. And as one gets older, it's harder to maintain that high intensity exercise level, even if you so desire. So the question is, does really brisk walking, is that good enough for high intensity exercise? And would you suggest that?
Short answer is absolutely. Most likely that brisk walking is getting you into a heart rate range that is going to be beneficial for your body, and you may not even know it. Perhaps you're not wearing that heart rate monitor, or you're not stopping to check your pulse in in certain ways. But I would recommend that maybe you add some type of heart rate monitoring to that brisk walking and monitor that intensity. And my bias would be that you're probably reaching the intensity that you need and will cause benefits for your overall health. So absolutely.
Okay, I'm going to just take one more because it's such a good question. And that's to you, Brett, and then we will end. And I'll just email answers to the ones that I wanted to answer. And that is, if one has issues with joints, and that's a very common problem that I see in my clinical practice. And what types of high intensity exercises do you recommend for individuals who have joint issues, Brett?
So first and foremost, we would look at non-weight bearing stuff. So cycling, New Step is a very, very good machine that can still get people's heart rate out. It is a little more specific in certain, right? It's a high-end machine, so it's a little harder to find. But anything that kind of takes some load off the weight and then, or mixes it. So it could be like, hey, I'm going to do a high intensity bout of 3 to 4 minutes of something that's non-weight bearing, and then bring a little bit of weight bearing in and start to slowly increase that and see where the joints kind of respond to that. Because yes, I've worked with so many people where a back or a hip or a knee, it doesn't mean they can never do anything again. And actually, I would encourage to try to find those areas where they can work through, maybe even it's just a slight little discomfort in the joint, but it's not causing it any other risk or injury. So it's balancing that. Working with a professional, a personal trainer is very, very good, because it helps us then gauge and see, offer, modifications to exercises, things like that.
Okay, well, I want to thank Jake and Brett for joining me today, and thank all our participants for listening to us. I hope you've learned something. I know I have. And we hope you'll join us for our next symposium, our next mini symposium in about 3 months, and it'll be relevant to the topic of brain health. Thank you so much. And again, please feel free to reach out to me at any time with any questions you have. And I hope you have a nice afternoon and a nice upcoming weekend. Thank you again for joining us.